Hey guys, today we are talking about general and special pathology, objectives, basic terminology, purpose, and task methods. Pathology is the study of disease. In Greek, pathos means disease and logos means study. Pathology investigates an etiology, which is the cause of the disease, and we have some couple of factors. So the first factor is the biological agents, which are bacteria and viruses, of course. The physical forces, trauma burns, and the chemical agents, poison and alcohol. The majority of diseases are multifactorial, which can be cancer, heart disease, or diabetes. Pathogenesis is an underlying mechanism, sequence of cellular and tissue events from initial contact with etiologic agents until expression of the disease. Etiology describes what sets the disease, process, and motion. Pathogenesis describes how the disease process evolves. Pathology bridges clinical practice and basic sciences to understand structural and functional changes in the cell, tissues, and organs. We have two divisions, which is first the general one, studies common changes in all tissues, for example, inflammation, cancer, and aging. Systemic is studies particular responses of specialized organs, for example, goiter or breast cancer. So we have the basic terminology, which is the disease, first of all, which is the condition of impaired dynamic equilibrium of organism within the environment, and structural or functional abnormalities. Health is the condition of dynamic equilibrium of an organism within the environment. Complete physical, mental, social well-being, not merely the absence of disease. And for disease, you have a couple of types. First type is inflammatory, neoplastic, and degenerative. Acute, days or weeks. Chronic is months until years. This is important to know because if you have an acute or chronic gastritis, you treat it differently. The treatment for acute gastritis would be, for example, antihistamines, H2, or prokinetics. But for the chronic gastritis, we have even three types, and each type you treat differently. For example, if you have type A, you make parenteral substitution from cobalamin. If you have type B, you make eradication therapy, give antibiotics, and if you have type C, you can go even through surgery. So first of all, you have always differentiate if it's an acute or chronic disease. One more type of a disease is the congenital, which is at birth. Familial, acquired, after birth, etc. The next type would be genetic. For example, if you have a patient who has BRCA1 or BRCA2, which is the gene for the breast cancer for women, then their children are very likely to get the same. So you can do a preventive blastectomy from the mama carcinome to avoid getting metastasis. Then of course we have the environment. If you have patients who work in the working areas, they have a lot of dust, then they're most likely to get bronchial diseases. So we have four aspects of diseases. We have the etiology, like we said, this is a cause. We have the second one, which is the pathogenesis, which is the underlying mechanism. The third one is the morphology, which is the appearance, which changes in macro and microscopic structures of cells and tissues. Biochemical alterations in body fluids, for example, blood and urine, and molecular changes. Number four, clinical significance. The patient's signs and symptoms related to underlying pathology. Then we have number four, which is the clinical significance, the patient's signs and symptoms related to the underlying pathology. Signs. What are signs? Signs are the manifestation noted by the observer, for example, elevated temperature or pupil size change, etc. Symptoms can be subjective complaints by person with disorder, which has pain, dizziness, or whatever. Then you have to decide what is the prognosis of the disease and the treatment suitable for the patient. Outcome of the disease. Then we have three outcomes of the disease. We have the recovery, of course. You give the patient treatment, recover after some days or weeks, and he's totally fine. Then we have the second one, is the not full recovery. This means the patient has the same disease, but this one doesn't have to show all the symptoms all the time. So you have a chronic disease. It comes back, it goes. And the third one, of course, is not like the treatment was not suitable for the patient, or you couldn't do anything for the patient anymore, and which leads to death, unfortunately. And we have two types of death. The first one is the clinical death, cessation of blood circulation and breathing, brain function, and CPR. Then we have the biological death, irreversible stopping of circulatory and respiratory functions and all functions of the brain. Late signs of death, which is after the death, of course. So we have late signs of death, which is alga mortis, which means body cools after death, which is obvious. We have livor mortis, it's a discoloration, you get the pale skin, which is caused by gravity, the blood goes where the body lies. Rigor mortis is muscle stiffen. And we have decomposition, which is 2 to 3 days in a bad smell. So what are our methods? First is the autopsy. We have a hospital autopsy, where the patient in the hospital died of natural cause. Then we have the forensic autopsy. There, the doctors investigate death in case of violence. The functions are identical cause of death, scientific research, source of info, effect and treatment of disease. And the second one is the biopsy, which is divided in histological and cytological investigation. So the histological investigation investigates pieces of tissue. Surgery, frozen sections, endoscopy, large needle biopsy. For the cytological investigation, investigates isolated cells, smears, body fluids, fine needle biopsy of thyroid, prostate, lymph node, and vaginal smear. So how does it work? For the histological investigation, take 10% formalin, then paraffin embedding block, cut via microtome, and in the end staining by HE and Sudan 3. For the cytological smear, it is basically drying on air, then you make an alcohol fixation and the staining in the end. Thank you very much, I hope it helped you. And also please let me know if you have any suggestions for this channel or what you like to hear. Thank you very much.